Hi everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to go over one great exercise to do before and after your knee replacement surgery. Before I jump into that, be sure to hit the subscribe button, turn on the notifications to catch all of our latest videos. So the one great exercise is sit-to-stands. This is a great exercise for a variety of reasons. So one, it's very functional. We all have to get up from our chair. We all have to get up from the toilet, the edge of the bed, our couch, our sofa, our recliner. We do multiple sit-to-stands throughout our day, every day basically. So it's very functional. Second, it incorporates lots of different muscle groups and lots of different joints. Your ankles, your knees, your hips are all involved. Your glutes, your quadriceps, almost all of your muscles of your legs and lower body are involved when performing a sit-to-stand. So it's very functional, it incorporates lots of different muscle groups and joints. And also it's very easy to regress and make easier if needed, or progress and make harder as needed, and also to transition to actually doing body weight squats or some different variations of squats that I'll show at the end of the video here. So in its simplest form, a sit-to-stand, with your arms crossed or on your lap. You're going to start from sitting and you're going to stand up all the way and sit back down. And usually I'll have my patients do maybe 10 or 15 repetitions at a time. Now some ways to make it easier early on is one, use your hands to push up. So if you have armrests, use the armrest to push up from, or use the seat of the chair to push yourself up. You can also change the height of the chair, so to make it easier, have the chair up higher and you don't have to go from such a low position. Easy way to do that is put some pillows or cushions on your chair, so you're starting up a little bit higher. Of course, on the flip side of that, to make it more challenging, is not use your arms as assistants, so have your arms crossed or just at your side. And then also start from a lower position, so a lower chair, take that pillow or cushion out, or just start from a lower chair in general. Easy ways to progress or regress the sit-to-stand. Some other things you can do is, so there's just your normal sit-to-stand where you stand up and sit back down all the way. And then what you can do as you get stronger is do sit-to-stand taps. So as you come down, instead of sitting down all the way, you're just going to tap your bottom and come back up. So it starts to incorporate a little bit more muscle control and strengthening with that downward eccentric component. And it's going to start to mimic more of a normal body weight squat. So doing sit-to-stand taps. You can incorporate some weight. So an easy way is take a kettlebell or a dumbbell and just hold it in front of you like a goblet squat position. And just do some sit-to-stands like this. Of course, easy enough, that can transition to just doing goblet squats without the chair. You can also do single leg sit-to-stands. That's of course going to make it a lot more challenging, also incorporate some balance and coordination with that. So a lot of easy different ways to modify the sit-to-stand. And then I always love to progress as my patients get stronger, get better muscle control, range of motion in the knee, to just performing body weight squats. And one of the easy ways to do that is holding on to your kitchen sink, standing at your kitchen counter, where you can really grip on and have that support. And what this allows you to do is as you hang on with your hands, you can sit back into that squat and then come back up. And as you sit back into that squat, you're getting a little more coming from your glutes. Your knees aren't tracking forward as much. So it's a really easy way to start to incorporate doing body weight squats that is tolerable. You feel stable. You're not putting as much stress through your knees necessarily getting a little bit more coming from your hips and your glutes as you sit back into the body weight squat. So that's just a couple reasons why I really love sit to stands. It's a great exercise before or after your knee replacement surgery. As always, please leave your comments and questions below. Hit that like button if you found this video helpful. Thank you very much for watching.